is Dr. Hannah Hamlin, and I am a person living with type 1 diabetes. Today I'm going to talk about 7 tips to prepare for exercising with type 1 diabetes. And this will be a quick run through, and I'll have a lot more detailed notes with a synopsis down in the comment section. But first, tip number 1 is to monitor your blood glucose level. So this seems pretty obvious that we want to keep an eye on our blood sugar while we're working out. But specifically monitoring our blood sugars before, during, and after the workout creates this kind of space for different needs. So before a workout, it's important to, whether you're pricking your fingers and doing kind of blood glucose checks through a regular meter or you're wearing a continuous glucose monitor, it's important to understand what direction your blood glucose is moving in. If you are about to go on a long run and you are maybe, say, running along here at 140 and you are dropping, let's say you were 190 just a few minutes before, maybe, worth understanding that as you go into a run. Also, kind of vice versa, if you're gonna go lift heavy weights and do some squats and try to get a PR and you're already spiking at 180 double up arrow on your CGM, it's important to kind of understand that as you're planning. So not only looking at what's happening to your blood glucose while you're working out, but understanding the direction it's moving when you start can help you predetermine or pre-predict lows that might happen or increased insulin needs that might be a part of it. The other piece is looking at your blood glucose after you work out. And that's also important because what we see is that people in general have an increase in insulin sensitivity after workouts. Typically, this can be seen within the 24 hours after an intense workout. And so it's important to understand that you're going to be more predisposed to low blood sugars at that time, not just while you're working out, again, but after the workout for up to 24 hours. And so taking a look at understanding kind of maybe whether you want to set an alarm in the middle of the night to check on things, or if you wear continuous glucose monitors and you have your alarm set up, maybe be prepared with more low blood sugar snacks if you're going to go to an event or something after a heavier workout. The next part is just planning ahead. Anytime I'm planning to work out, I've always got my diabetes kit with me, and I don't always use it. In fact, most of the time I don't use it, but it's an important piece to have, and your insulin with you and some type of blood glucose raising agent in order to be kind of prepared with anything that might happen. Now, if you are going on a long run or exercising in a way where you don't have a place where you can just throw a bag down in the corner, then what can be helpful is finding a bag that works for you that's functional. A lot of people, that's kind of some version of an exercise fanny pack that'll be able to hold your diabetes needs, but that's really important, is to plan ahead and pack the right gear so that you've got everything you need in the case of an event happening that you're expecting or not expecting. The next is adjust insulin dose. So this is tip 3. And adjusting insulin dose for some people may be more important than others. And typically, in my own experience, it really matters on what type of workout I'm gonna do and the intensity. So if I'm gonna just go on a slow jog walk, I might not need to adjust my insulin levels, but if I'm gonna go on a heavy run or go to a workout class where I know it's gonna be pretty intense for 45 minutes or so, I may look at changing whether it be my basal rate or bolusing for insulin in a way that is less at the previous meal, so I have less insulin on board. Now, this is a process of learning and something you absolutely want to talk to your own doctor about, because often we can use old data to kind of trend what might be a good fit. But typically, those heavier exercises are a good time to adjust insulin dose, and usually that means lowering it. Now, with some of the insulin pumps, they've got different forms of activity mode. I use Omnipod 5 and the Dexcom G6, and right now there's an activity mode on the Omnipod. Now, to be honest, the activity mode settings I found are a little bit too extreme for me. They take away too much insulin, and I find myself elevating a little bit after. So I haven't leaned into that setting, but again, maybe my workouts aren't heavy enough or intense enough at this time in order to use that. So I recommend not only talking with your physician about a kind of game plan for adjusting insulin based on different types of workouts, playing around with it yourself, but also looking at your insulin pump, look at the technology you've got and see if there's anything that's automated there that could be an additional helpful tool. Now, step number 4 is carbohydrate intake. It's often common for people to think that they need to eat a big snack or bump their blood glucose levels up really high before a workout because they notice that they become more insulin sensitive. They use that glucose and they drop. Now that is one strategy, eating a snack or allowing your blood sugars to run a little higher before a workout to prevent lows. That is something that can be effective. Now, I don't think it's a great long-term strategy though, because that elevated blood glucose and then the big drop is something that does put stress on your body. Certainly going to work out with a blood sugar of 250 doesn't feel as good as going to work out with a blood sugar of 110 or 120. And so not only is it a long-term health kind of A1C benefit, but also just a day-to-day kind of feeling better in your workouts. There are ways to get through an intense workout without having to boost your blood sugar up really high to kind of cover your bases. And it really goes back to that last tip number 3, which was adjusting the insulin needs before the workout. And so if you can do that right, if you have less insulin on board during your workout, you're less likely to drop. And that's really a big key here. Now, step number 5 is hydration. Hydration is huge. And when we are dehydrated, it's much easier for our bodies to have higher blood glucose levels. And the main reason, if you think about it, is when we measure our blood glucose levels, it comes back in the measurement of milligrams per deciliter, which is the concentration. So if we have the same amount of glucose in our bloodstream, but we are dehydrated, we have less total concentration, the number is going to go up. Now that's one way to think about it. There are kind of a lot of nuance there, but essentially staying hydrated is huge for preventing hyperglycemia, and something that's kind of more important for us to think about living with type 1 diabetes than the average Joe. Now, the next tip is recovery. Recovery is huge. And again, that recovery period, we may have prolonged increase in insulin sensitivity, thus needing either more carbs or less insulin during that time. But recovery is really important for anybody working out. It's just often a piece that's forgotten about. It's really easy for us to push ourselves into too much exercise. Also, it's kind of, we have kind of, that's a misnomer I find in the health space, is that it's possible to over-exercise. And I see that actually all the time with my really health-oriented patients, is that we think we're doing a good thing for our body, and in truth we are. We're really trying to exercise a lot, but there is an upper limit for people. It's not the same for everybody. It's not the same in every chapter of life, so I don't want to give you these kind of limits and create kind of a limiting belief or a concern, but I think it's important to look at whether or not you're getting enough time for recovery, how you feel when you're starting your workouts, how you feel when you wake up in the morning. If you're completely exhausted by the amount of exercise that you're doing and you're doing it over kind of a chronic long-term plan, maybe worth considering talking with your physician or your healthcare professional and finding out whether or not the amount of exercise that you're doing is putting additional stress on your body, because we do see that. So I think it's important to note here. And then the last tip 7, is safety precautions. And really that includes carrying your glucagon, which is not always the most convenient thing to carry, especially when I go on a run. I hate that it kind of takes up most of the room in my fanny pack, but it's important. I think definitely having a glucagon in your school bag or your gym bag, if you're exercising at school, or if you're going to the gym, having it on you is important, because we can't predict when an emergency might happen. We absolutely plan for them not to happen, and that's the goal, right? We set that standard where we're trying to get to a place where we're not ever needing to rely on that, but it does happen, and it's not predictable. We do know that when we're exercising, it's more likely that low blood sugars, extreme low blood sugars requiring glucagon could be a part of that picture, just because things are changing. It's not our usual routine. And so I highly recommend carrying your glucagon with you. I would recommend, if you can, get your provider to prescribe a couple so that it's easy to keep them in different places. I like to keep one in my gym bag and one in my purse, so I always have a glucagon on me, depending on, no matter which kind of bag I grab when I'm leaving the house. So those are my 7 tips for exercise. There are a lot more, and again, check out the synopsis if you want kind of a reminder or a checklist guide. Exercising with type 1 diabetes, in my experience, isn't intuitive. the blood glucose management piece isn't always intuitive. I like to think that it's easy for me to guess how I'm going to respond to a new workout, but that's not always the case. It's really in my life been trial and error. And then you get to a place where you can predict it and it does work out well, but I don't always nail it the first time. So if you're experimenting with this and you're really trying to lean into a new workout program or try a new type of exercise, know that it's okay if you don't just absolutely nail perfect blood sugars the first workout. That doesn't happen in my experience for most of us. And it is something that we learn as we do, but absolutely exercising is worth it in my eyes with type 1 diabetes. If you're interested in more exercise tips or educational videos, I will link them below. If you'd like to work with me, I'm seeing patients in the state of Texas right now, and you can check out my scheduling website as well in the links. And if you would like to stay connected on Instagram, I've got a lot of fun content coming out there. So thanks so much for watching, and if you have any leftover questions, please let me know in the comments. Thanks.